Welcome, everyone. Thank you for joining us tonight. We're going to give it a couple more minutes before we start the main part of our webinar. But before we do start, I'd like to go over some housekeeping items. All attendees will be muted for the duration of the webinar. Oh, I'm sorry. There will be no trivia tonight. That was from a previous webinar. If you have any questions, you can ask them through the Q&A icon at the bottom of the Zoom window. If you're on a desktop, you can hover over the bottom of the Zoom window and you'll see the Q&A icon on the menu bar. It looks like this. And if you're on a mobile device, you can gently tap your screen and the menu bar with the Q&A icon will appear. We will take all of our questions after the presentation. We can't guarantee that we'll get to every question, but we will try to answer as many as possible in the time allowed. All of the attendees will receive the presentation slides after the presentation. We will email them to you. And this webinar is being recorded. It will be available for viewing on the Arlington Library's website and our YouTube channel. This presentation is an educational program. It will be delivered by medical professionals from the Northern Virginia Holistic Primary Care. Arlington Public Library uses subject matter experts from a variety of sources to provide educational public programs. We do not endorse, suggest, or recommend a specific company, service, or product. And before we get started, I did want to give you some general information of a website to go to for what Arlington County is doing in terms of the vaccine rollout. If you go to this website here, arlingtonva.us/COVID-19/vaccines, you will be able to get a lot of information about what Arlington County specifically is doing about the COVID-19 vaccine. So thank you all for joining us again. I would like to go ahead and do the introduction now. February is American Heart Month, and we can celebrate by motivating ourselves and others to adopt healthy lifestyles to prevent heart disease. I'd like to welcome our speakers, the staff of Northern Virginia Holistic Primary Care. Dr. Selma Hawk is board certified in internal medicine and has been practicing in the area for the past 15 years. Riley Shelton has been a nurse practitioner since 2012. Their practice focuses on preventative care, which is why they're here tonight to speak to us about cardiovascular risk. Thank you both for being here tonight. We really appreciate it.
Thank you, Megan. Can you hear me fine?
Yes, we can hear you and we can see the slides.
Okay. All right. Good evening and thank you for joining us tonight. We hope each of you find personal benefit in the presentation. This evening, we will be discussing what is your cardiovascular risk. And it's an important question we all need to ask ourselves and to assess, especially because the most powerful way to combat cardiovascular disease is through prevention. So Megan has kindly introduced us, so I can skip over most of this. I would like to mention, however, that this presentation, before going further, this presentation is for educational purposes only and should not replace or be used for individual medical diagnosis or treatment. So goals for tonight, I'm going to talk a little bit about primary prevention, and then to give a concrete understanding over the topic, we will start with talking about the heart, the normal physiology, what happens when something goes wrong, and what is actually occurring in the heart when someone has a heart attack. From there, Rachel will discuss the most important individual risk factors we all have control over to change. and she will list out ways to assess these risks, as well as tests you can ask your doctor for if they haven't been done. We would love to discuss treatment, and when applicable, we will give a few pointers on that, but it's too large a topic for today's presentation. So primary prevention means guarding against ever developing a disease. It's protecting yourself before a diagnosis. It's about being proactive rather than retroactive. Through primary care, we want to empower people to take health back into their own hands and to reverse the epidemics that we're seeing today. And the best way to do this is not going to be through taking prescription medication. There are many early signs to catch developing cardiovascular disease before it's too late. And these signs show up years before an actual cardiovascular event occurs. Our goal must be to have an awareness of these signs and to reverse them in their tracks. And for those who have cardiovascular disease, we don't want to band-aid treat. We want to reverse these same risk factors that are the threat. Addressing these core issues will also reduce your risk for developing high blood pressure, diabetes, autoimmune disorders, stroke, dementia, and many cancers. And some of these, if you have already been diagnosed, can be reversed. So we will start with the heart's normal structure and physiology. You don't need to know any details on this slide. It's just about getting the big picture. So here you see the heart, and we functionally divide it into the right side relative to the patient, which is seen in blue, and then the left side seen in red. Our hearts are a muscle about the size of our hands clasped together, and they're comprised of 4 chambers. Your right atrium, located right here, right atrium literally means entry hall, and it serves as exactly that. It's the receiving room, and the rest of your body will use this chamber to send back deoxygenated or used blood. And from here, it's pumped down into the right ventricle, which sends it via the pulmonary artery to your lungs. And your lungs do their job. You take in deep breaths, clean oxygen comes in. There are trades made in your lung tissue. And now you have your returning blood that's oxygenated entering into the left side of the heart. It moves from the left atrium to the left ventricle. And from there, it's pumped into the largest blood vessel in your body, which is the aorta. And that will go on to supply the rest of the vasculature in your body. So a couple of interesting facts to appreciate this organ beating inside of you. According to the Texas Heart Institute, your heart pumps approximately 2,000 gallons every single day, and it beats approximately 100,000 times per day. The heart never takes a break, and we don't really want it to stop or take a break. And while the rest of your body takes the night off, your heart is constantly pumping and supplying the body. So where is the heart muscle receiving its supply of oxygen and nutrients from? We have a network of arteries that branch off of the aorta, and they're referred to as the coronary circulation. These wrap around the heart muscle and can be seen on along the exterior of the heart. The main players are the right coronary artery, which will have a couple of branches and supplies predominantly the right side of the heart. And the left main will branch into usually a prominent left anterior descending artery and the circumflex. And these will predominantly supply the left side of the heart. These are the main culprits that will be involved when you hear about heart disease or heart attacks. And each of these arteries are just a few millimeters in diameter. And your heart is depending on these arteries to be healthy and functional. So let's take a closer look at what's going on inside these tiny arterial walls. We want these arteries to have healthy flexible, smooth walls. And floating inside along these walls, we have, along with our other blood cells, we have cholesterol, which is being carried by lipoproteins. The interior lining of the wall is called the endothelium, and it's very powerful and responsive to its environment. When it stops being so, we start seeing problems. So if you have healthy walls that are not inflamed and you have healthy lipoproteins, you don't have a problem. But when the lining becomes irritated and inflamed, and you have damaged cholesterol carriers, these cholesterol carriers start attaching to and actually will start digging into that endothelial lining. And this will upset your immune system, which will throw some macrophages in to attack those particles that are digging into your wall. And that will trigger other inflammatory markers to show up and join. And now you have a plaque building along the wall. And this plaque can sit there for dormant for years. But when the plaque cracks and its toxic contents are exposed, it can throw emboli or little clots further down and occlude the vessel, or it can actually stimulate blood clot formation immediately and occlude that blood vessel. And now that heart muscle that was being supplied distally by this blood vessel is no longer receiving its oxygen or nutrients, and pain is felt, and then the muscle starts to die. When this happens, the person is experiencing a heart attack, also known as myocardial infarction. Myocardial means heart muscle, infarction means death. And though technically it means muscle death, I'd like to note that because of the reperfusion treatments we have in the CCU today, thankfully, the heart muscle will often recover if treated quickly. So classic symptoms include chest pain, which is often just behind the breastbone, or it can be left-sided, sometimes right-sided. Some patients will just come in with abdominal pain. It's often described as a dull ache, a pressure, and then the classic textbook phrase is an elephant sitting on my chest. Sometimes there will be radiation to the jaw or to one or both arms, and it can be associated with nausea, vomiting, anxiety, sweating, shortness of breath, lightheadedness, reflux. And some people will get just one of these symptoms, like just shortness of breath or just nausea and vomiting. And a few people will actually not have any symptoms. Women more commonly will have atypical presentations. So it's important to have a heightened awareness and to consider this diagnosis even when chest pain is not necessarily present. Our goal is to address the causative factors before they ever lead down to this point. So standard guidelines on assessing your risk. So when you go to the doctor, they estimate your risk, and this is usually done using the atherosclerotic cardiovascular disease risk calculator from the American College of Cardiology. They look at this and they look at LDL levels generally. You can actually calculate your risk using this link here, and we'll have the slides available to you later. But there are major concerns and limitations with basing your risk on this alone. So when you put in your numbers, it will give back to you a 10-year and a lifetime risk as a percentage for having a cardiovascular event like a heart attack or a stroke. And this 10-year risk, along with the LDL level, will be used to determine what sort of intervention will be recommended to you. And it varies in accuracy, and it's a very rough estimate. So what risk factors go into the calculation? The non-modifiable are your age, gender, and race. And then the modifiable risk factors are your blood pressure, your cholesterol levels, whether you have diabetes or not, smoking history, and whether you're on medication for blood pressure, cholesterol, or taking aspirin. So how reliable is it to use this calculator and an LDL level and And do we have better ways of measuring our risks? So there's quite a large amount of data on this now. And I'm just mentioning one here. This study was published in the American Heart Journal, and they looked at 137,000 hospital admissions for heart attacks. And interestingly, what they found was that most of these patients who had heart attacks did not have high LDL levels or elevated total cholesterol. 75% of them had normal LDL levels. And we're clinically seeing this too often, where the numbers look ideal based off the current guidelines, yet the patient has a huge coronary artery calcium score, which is a significant risk factor. Or they have severe coronary artery disease on a heart cath, or they go on unsuspectingly to have a heart attack. And this has raised the question to a lot of investigators that maybe we are not addressing the most important risk factors with the current guidelines. So the rest of this presentation is going to focus on the risk factors that most directly are correlating with cardiovascular disease and how to protect your blood vessels, reduce inflammation, and keep that endothelial lining healthy, and make sure that your cholesterol carriers are not malfunctioning and depositing into your vessel walls. So we will go into more detail about many of the risk factors, some of which are mentioned in the calculator. Other factors, however, such as smoking, are not going to be the focus of tonight's lecture, mostly because we expect our audience to understand the huge risk that smoking plays in cardiovascular disease. That is not to underemphasize that quitting tobacco products is definitely a critical and first step. We wanted to at least mention that before diving in deeper. So we've broken down the risk factors into these topics, and I'm actually going to pass over the presentation to Rachel from here, and she's going to go into a lot more detail over these individual topics.
Can you hear me now?
Yes, we can hear you.
Okay, good. Okay, I'm Rachel. I'm going to take the presentation from here. So we talked, somewhat reviewed, we talked about cardiovascular disease starting when our blood vessel walls get injured or damaged, and when those lipid carriers get injured or damaged. So now we want to go into the causes of these injuries, and starting with chronic inflammation. So we're all familiar with, our sprained ankles, our lacerations, our insect bites, and that classic acute inflammatory response, that redness, swelling, pain. That's a natural acute inflammatory response. It calls on our immune system cells to battle over that injured territory. It destroys any potential invading bacteria, and restores and regenerates that tissue. So that short-term process is necessary for our health. Oh, there we go. So what happens when the inflammation is occurring in our bodies and stays on permanently? So chronic inflammation is an ongoing battle when our body gets stuck in that fight mode, and it continually releases those cytokines and all those inflammatory hormones. It ends up damaging our own tissues and our organs, and it slowly starts to destroy them. So oftentimes we won't have obvious symptoms until we have moderate damage. And that's generally have that with chronic conditions that we hear of now, those autoimmune disorders with such as MS, lupus, inflammatory bowel, diabetes, cancers, even dementia, arthritis, and heart disease. So keep in mind, we're not always going to have symptoms with chronic inflammation. So how do we know if we're in a chronic inflammatory state? We have some simple blood tests that can help us answer these questions. Some of them you've had at your annual physical, likely, the hemoglobin A1C being most recognizable. And that gives us an idea of your blood sugar over the last 3 months. It's just a better picture than that random fasting blood sugar that we'll see in some of your chemistries. Another marker we can look at is that high sensitive C-reactive protein. It's one of the most predictive of all the inflammatory markers, and it's backed by a lot of research to be a significant cardiovascular risk. It's becoming more common. Now, you wouldn't want to draw either this one, the high sensitive CRP, or the ESR if you have an acute infection or an acute process going on, as that can elevate these markers. But if you're not noticeably sick or no other acute issue is going on and it is elevated, we would want to investigate that further, particularly cardiovascular system. And so I mentioned the ESR, that's another inflammatory marker. It's a little bit less specific than the CRP, but again, if elevated, it warrants more of an investigation. And then finally, the homocysteine. Homocysteine is another blood test that you can speak to your physician about. And that's a simple lab test. High levels have been linked to early heart disease. So high homocysteine levels can lead to damage in our blood vessel linings. It can increase our risk for blood clots to our brain, the blood vessels and heart. It's also been associated with low vitamin B6, 12, and folate. So one of the greatest causes of chronic inflammation, and if I can instill anything in you guys today, it would be this, is elevated blood sugar and elevated insulin. So let's start a little bit in talking about what these terms mean. So when you eat a meal, your body will process it. It will break down that carbohydrate load into glucose, and then that glucose will enter your bloodstream. So we have two issues we want to address. Your cells will need some of that glucose to produce energy, and then it needs help to access that glucose. So the second being, your body wants to get that excess glucose from your bloodstream and into their cells and tissue, because over time that tissue is going to, if left unassisted, it will attach to those other cells and harden the tissue, deposit along those blood vessel walls and clot capillaries. So for example, when we clot small capillaries in our eyes, we'll have blindness, which you often see in late stage diabetes. When it attaches to the white blood cell, we will have non-functioning, they will become non-functioning and lead to immune disorders or unregulated cancer growth. So they will also bind and damage those cholesterol carriers, which starts collecting on the blood vessel walls. So this wasn't so much a problem, with our great grandparents, and they were just indulging in sugary treats on special occasions, because in small amounts, we have amazing cleanup crews in our body, but we are now chronically exposing our bodies to high glucose levels that it can't tolerate. So how do we get this sugar out of our bloodstream and into our cells? Our body creates the hormone insulin. And so when sugar levels are too high, that pancreas is told to send out that insulin, the guy here with the key. So he unlocks our cells and helps the sugar leave from our bloodstream and into our cells and our tissue for either energy or storage of fat. And then the blood sugar levels return to normal. And this is a normal way our body processes glucose. So this works great until we're constantly calling insulin with his key. So not only is insulin inflammatory hormone, we don't really want it hanging around in high numbers. The cells are no longer impressed with this guy when he's always there and ever present. And so they just stop responding. So now you have lots of sugar that's not leaving that bloodstream, as we talked about how this can wreak havoc in our bodies. But we also then have that high inflammatory hormone insulin, and that scenario is diabetes. So initially when this happens, the pancreas pumps out much more insulin, and the resistant cells are forced to respond, and usually in usually very high number or levels of insulin, the body is able to respond and get that sugar out of the bloodstream. And this is the pre-diabetic stage. And it's also known as insulin resistance. So insulin resistance is the biggest contributor to cardiovascular health. 1 in 3 Americans have insulin resistance. So it's the single most phenomenon that leads to rapid premature aging and leads to many of the chronic diseases that I previously mentioned. So some signs and symptoms of insulin resistance, and it's different, everybody's different. So, you know, this might be different for everyone, but can be that increased thirst or frequent urination, that increased abdominal obesity or central obesity, fatigue, especially after eating, or hypoglycemic episodes or low blood sugar spells, blurred vision or elevated random blood sugars. And we can have some skin changes where we might get some dark patches around our neck, groin, or armpit. So we did discuss the A1C, and that most of us have already had or heard about, and also the fasting glucose. But I do want to mention a fasting blood glucose of 100 to 125 is considered pre-diabetic. 126 or greater would be diabetic. But I will say a fasting blood sugar of greater than 90 is generally indicative that there's a problem. But I will, just to mention, a more sensitive test would be a fasting insulin level. And as you understand from our previous slides, when the problem first starts, your insulin levels will climb, and they will manage to keep your blood sugar normal for a few years, but it's best to catch it in that first stage, the beginning of insulin resistance. And lastly, I'll just mention this 2-hour glucose tolerance test. Now, it's not necessary if you've had you know, a lot of these other screening tests, but I just wanted you to know it's out there. If you've been pregnant, you've had it. It's not fun, but just so you know, it's out there. So if you have insulin resistance, or if you've ever been told you're pre-diabetic, so I'd love for you to discuss further with your physician about metabolic syndrome. So you should educate yourself. Do you fit into 1 or 2 or 3 of these categories? If you do, it's time to dig a bit deeper into your health and make some changes. And the sooner rather, the better. So what is metabolic syndrome? To be diagnosed with metabolic syndrome, you need at least 3 of the 5 from this list. The first being the abdominal obesity, which would be that midsection, waist greater than 40 inches for men and then 35 for women. This increased waistline has been found to be significantly associated with cardiovascular disease. So much so that it's becoming the norm at your annual visits to have your waist measured. Triglycerides, elevated triglycerides, low HDL, which is your good cholesterol, and then elevated blood pressure greater than 130/80, and then that elevated fasting blood sugar that we talked about. So some of the risk factors or contributory factors that lead to this chronic inflammation, and I'll go into a few of them next, and that would be stress. We all know that stress is bad, but we know how damaging prolonged stress can be. So remember that short-term acute stress, that fight or flight, is a protective mechanism for us to survive, and it's our body responding appropriately. But chronic stress is detrimental and leads to chronic inflammation. So it's believed that stress is a contributory factor to 80% of all chronic conditions. A sign of that chronically elevated cortisol or that stress hormone is that increased waistline that I talked about. We know that it's strongly associated with cardiovascular disease, which puts us at increased risk for heart attack. So many things in our life can cause chronic stress in our bodies, but I just want to highlight 2 of them on this list. So sleep being one, which is so incredibly important for our bodies. It's recommended that we get 7 to 8 hours of sleep a night and keep that circadian rhythm. So that lack of sleep can affect the hormones that control feeling of hunger and fullness. It can trigger the release of insulin. When we sleep, it helps our heart vessels to heal and rebuild. It affects processes that maintain our blood pressure, our glucose levels, and inflammation. When we don't get enough sleep, it puts us more prone to infections. It affects our prefrontal cortex it affects our reasoning and our amygdala, which affects our emotion. That lack of sleep may help make it harder for people to form new memories and learn. And I will just mention, if somebody in your family mentions that you snore, or if you're waking up snoring, that can be a sign of sleep apnea. And so that's really critical to address for reasons I just mentioned. And then the second on this list being over-exercise. So exercise is amazing. It's a great stress reducer. It's excellent for your health. But when we do overdo it too often, it can become a negative thing. So doing an extreme workout will cause your cortisol levels to spike. And it's like putting out a fire with fuel. It makes that situation much, much worse. So that signs and symptoms of cortisol imbalance can be that reduced libido, anxious or depressive thoughts, short-term memory, changes in your menstrual cycle, exhaustion. So my take-home point with this slide is I want us to slow down, which right now is really hard. And in our society, and especially here in the DC area, we're always pushing ourselves and working 24/7, balancing our families. But we need to really work hard to find that work-life balance, that get enough rest, sleep, meditation, journaling, socializing, which is really hard right now, deep breathing, and setting boundaries. So we can't really avoid stress that comes to us, but we can control how we respond to it. So let's dive a little bit into carbs and diet and how that plays a role in our cardiovascular health and chronic inflammation. It's a kind of a recurring theme here. Carbs are a macronutrient, and they're important for energy for your brain and muscles. When we talk or think about carbs, we often think about those breads and sweets. But when we reference carbs, we want you to think about those healthy, naturally occurring carbs that are in vegetables, fruits, whole grains in moderations, beans, legumes. So as we said before, one of the leading causes of chronic inflammation is that elevated blood sugar from those carbs and sugar. And so those refined white flours, starchy foods, juices, sodas, those trigger a dangerous chain reaction in our bodies. And carbs contain glucose, fructose, or a combination. They can affect and raise our triglycerides, and they can increase our small, dense, more dangerous LDL, which in turn damages our arteries and leads us down that path of insulin resistance, metabolic disorder, cardiovascular disease. So we want you to choose your carbs wisely. So an interesting fact, on average, Americans eat currently 152 pounds of sugar a year, in comparison to 1915, when on average Americans consumed 17.5 pounds per year. So it's gone up significantly. So excessive amounts of carbs in our diet is more fattening and more dangerous than saturated fats. So we really need to slowly start increasing your fruits and vegetable servings while reducing those white foods, the sweet, the sugary sodas, juices. And remember that heart healthy eating is a marathon and it's not a sprint. So it's about creating those daily habits. fats are a really misunderstood nutrient. So it's been ingrained in our head over the last 3 to 4 decades that we've been told that low fat, low cholesterol diets have great health benefits. But there is mounting evidence against this conventional advice. So the right, well-sourced fats are essential in supporting immune function, regulating body temperature, help in the regulation of sex hormones. They help in the absorption of fat-soluble vitamins. They're a primary energy source, and they maintain good gut health, which is vitally important. So the standard American diet incorporates a lot of bad fats. So that diet is high in saturated animal fats and trans fats from processed foods. Two really important points that I want you to take home in relation to fats is, one, healthy, well-sourced fats, grass-fed, are necessary essential nutrients. Studies have shown that omega-3 fatty acids can reduce that risk of coronary heart disease by making your cholesterol markers healthier and reducing inflammation in those arterial walls. So some sources of omega-3 can be found in those cold water fish like salmon, mackerel, herring, fish oil, algae, flax is another good source. And then my number 2 take-home point is I want you to remove those seed oils and trans fat from your diet. So industrialized seed oils like rapeseed or canola, corn, soy, cotton, they're not vegetable oils. And they may claim that they don't have trans fats, but when that bottle reaches you, they're very unstable, highly processed polyunsaturated fats, and they're not fit for consumption. So we want them out of your diet. Those processed foods are filled with trans fats containing partially hydrogenated oils. Then they don't naturally occur in our environment. They were created to maintain that longer shelf life and replace butter in the low-fat diet push. So I really want you to look at those labels. Those labels may claim 0 trans fat, but if you see hydrogenated or partially hydrogenated, you need to avoid them. So stay away from those shortening, the margarine, fried foods. You really need to look at those nut butters, which should really just have the nut and maybe that's it. Mayo, salad dressings. So eating those trans fats leads to buildup of the toxic substances in your body, and it leads to more inflammation. So get them out if you can. So I want to briefly touch on the cholesterol panel and cholesterol in general. Cholesterol has also been demonized. So like Selma said earlier, 75% of people that have had a heart attack generally have normal cholesterol. And it's important to think about that. Oftentimes when they're coming in the ER, they have undiagnosed insulin resistance or pre-diabetic or diabetes. So in general, cholesterol is an anti-inflammatory. And if it's high, there is usually some inflammation that's occurring in our body. So 25% of circulating cholesterol comes from our diet, and 75% of cholesterol is produced by our bodies in our liver, which also regulates the cholesterol. So what is it? We need cholesterol. It's a steroidal compound that's essential for our cell membranes. It's a precursor for hormones. It's essential for brain health. It's been found that lower cholesterol has been found in patients with lower cognitive decline. It's important for your immune system. It's an antioxidant. So looking at this cholesterol panel, it's really a snapshot of the whole picture. And I just want to review a few points on the panel. So we look at the LDL, which is that low density lipoprotein, that bad cholesterol. And that's a carrier that takes the cholesterol from our liver to the rest of our body. And when we look at that LDL on our panel, that number is really the weight of the LDL. So more importantly, we want to look at the pattern or particle size of that LDL. If a patient has a lighter or fluffier pattern, that pattern A LDL floating around in our vessels, it's really not so much a problem. But what we're more concerned with and puts us at higher risk for cardiovascular disease and inflammation in our vessels, and puts us at higher risk for heart attacks is that dense, small particle size or pattern B LDL. So to get a better picture of the particle size, we can look at the triglyceride HDL ratio that we can on our cholesterol panel, and that should be 1-to-1, and that gives us a little bit of a snapshot of that. But another test, just to have a further discussion with your provider, is an NMR. And that's an excellent test. It's a blood test, and it gives us a more detailed picture of what your lipid markers look like. Do you have those small, dense LDL particles? So that's a good discussion to have with your provider. And then the other thing we look at is the HDL, which is your high density lipoprotein, and that's your good cholesterol. That's the vehicle that takes your cholesterol from your tissues to your liver, and it's a protective lipoprotein. So I will just mention on our slides, our guidelines or our goals are a little bit lower for much lower for triglycerides. We want them a little bit lower, and higher for goals for our HDL as compared to the standard guidelines, because we feel they're really important markers, and they can be manipulated through our diet. Like we mentioned earlier, when we're eating those high carb, high sugars, oftentimes we'll see that triglyceride go up. So what causes cholesterol to be high? And we really need to look at root causes. It can be, shifts in our hormones, childbirth, breastfeeding. We can see elevation in our cholesterol there. I will mention as we can have effects of our cycle as well. So it's good to be tested and have your blood work done for your cholesterol at the end of your cycle. We want to look at your thyroid and make sure your thyroid is functioning well. So that's why I mentioned the thyroid panel on this slide. If it is dysfunctional, it will definitely elevate these numbers. So there's hidden infections, stress. We also want to look at that metabolic picture, your insulin resistance, your blood pressure, your waist circumference, your diet. And I will just mention 2 genetic variants. So, it's quite rare in our population, but there can be a familiar hypercholesteremia. So you would want to just make sure that wasn't an issue. And then there is a genetic disposition that puts us at higher risk for cardiovascular disease. And that's lipoprotein A, and that's a blood test. About 20% of our population do have this marker. So it's worth screening for. So there's so much that I would love to get into to improve these numbers, but we want you to at least recognize these risk factors. And lastly, on this slide, I will mention a coronary artery calcium score. It's an affordable CAT scan imaging test that assesses your plaque presence in your coronary arteries. It's not routine, but it would be useful in a difficult patient. So it's worth knowing about, but it's not a routine test. So I'm not going to go over all of these. You'll have these slides to reference, but I wanted to just mention, researchers have noted that levels of antioxidant vitamins in our blood are lower in people who have inflammation. So we really want you, if you're eating fruits and vegetables at least 5 times a day, you're off to a great start. But if you're not, I would encourage you to eat that rainbow that you've heard, eat colorful vegetables, antioxidant rich foods, because they protect your body from those free radicals. They help reduce inflammation and help to prevent some of those chronic diseases that we discussed. So movement is one of the primary keys to cardiovascular health. Specific kinds of exercises can alter the way genes function and interact in our cells, but by triggering the right genes, we can lessen inflammation, we can strengthen our cardiovascular health and system, and reverse some of our many aspects of aging. So it's recommended that we at least get 30 minutes, at least 5 days a week. We should have 2-to-1 ratio of aerobic to resistance training, which would be weight or weight-bearing exercise, so lifting weights. And I will say, if you're not an exerciser, you would really want to consult your doctor about jumping into the right plan or how to start, what's the best plan for you. But I would encourage you to start slow, grab a friend to help with motivation, and walking is a great start. And like I mentioned earlier, I would just want to say anybody that's over exercising or aggressively exercising should be cautious that you're not overstressing that body like we talked about. A good way to kind of check yourself with that is calculating your maximum aerobic heart rate and staying below that number. And I referenced on this slide Phil Maffetone, and he has some great resources online and books, and you can get a little bit of information on how to maintain or calculate that that heart rate and stay below that level. So in summary, we hope that we've given you the tools to understand cardiovascular health and deepen your conversations with your provider if and when they come up. We believe so strongly in prevention and having the knowledge to advocate for yourself or your family members, which is extremely important for longevity and good health. So I will just turn it over to questions and go from there.
Okay, I just want to remind all of our attendees, if you have questions, you can go to the Q&A icon in your menu bar. If you're on a desktop or laptop, you can hover over the bottom of your screen and the Q&A icon will appear there. And if you're on a mobile device, you can gently tap your screen and the menu will appear with the Q&A icon. Okay, we have our first question is asking about microbiomes. Can you give some information about that?
Hi, yeah. So that's actually, it's a huge topic now. We didn't go into that as much, but it is being considered a significant risk factor for cardiovascular disease. There are tests to look into that, and they're not part of the traditional labs. Some of them, there's a comprehensive stool test. Usually these are done with more functional labs. We have one that we do at our clinic, but often when there's inflammation and we don't find a source, it's often coming from the gut. And the difficulty is a lot of patients won't actually feel any symptoms. So it's an excellent question. It is something that is important in the assessment.
Thank you. Our next question is asking, where should they start? What would be your recommended first 3 steps?
I would start with having a conversation with your provider. I would definitely start for screening. You would want to start with that cholesterol panel, looking at those hemoglobin A1C, looking at the fasting blood sugar for screening tools, as to keep it maintaining or starting on maintaining good cardiovascular health. I would really look at your diet. That would probably be the first thing. If we can, lower those carbs, lower those high sugar things that we put in our body, that would probably be number 1, is looking at your diet. Number 2, talking to your physician or your provider about what's the best exercise, get moving is very important. And then reducing your stress, which is really hard. But those are probably where I would start. And Salma, you might, or Dr. Hug, you might have something different, but that's where I would start.
Yeah, I agree. I mean, one of the big, I'd like to say that it's not complicated, like it's within the reach for everyone. And especially, we talked a lot about primary prevention, but all of these diseases that people have can be reversed. And and it is a lot, like Rachel was saying, it is these lifestyle changes. It does require a lot of small changes in the life. Sleep is so huge. We're actually just getting through a large book on the circadian rhythm and how it affects all your hormones and balances. But the basic blood work, if you can't get an NMR, which really we would recommend the NMR, but if you can't get an NMR, there are ways of looking at that cholesterol panel and figuring out, okay, well, does it look like you have an issue with LDL particles? That looking at those ratios of cholesterol to HDL or triglycerides to HDL, they're really important cardiovascular risk markers. And they're so modifiable by the diet. Thyroid, I think that should be routine. I would also mention vitamin D. I think that we're all deficient in that, so that's something that definitely should be checked as well. But a lot of these, the CRP, you would have to wonder, why is your CRP elevated? And then, like that first question, actually, it is really important to look at the gut. I think one of the issues that come with that is it's a little bit more pricey to start the workup on that, which I think we've had some issues with that. But you can start repairing the gut without doing a full workup on it necessarily.
Thank you. Our next question asks, what are heart palpitations or racing heart, and what does it indicate?
Okay, so that's there's a pretty big differential on that. We like to have heart variability, but when you are having I guess you would call it an arrhythmia, where you're having episodes that your heart is beating fast, and there's a good amount of workup that's just routine, like looking at, again, like the thyroid and checking electrolytes, etc. Looking at a fluid balance. But once those common issues are just ruled out, then you do actually want to think about what, we were talking about, that endothelial lining. That endothelial lining is in the blood vessel is, it's going to respond very sensitively to inflammation. And so if you do have persistent high heartbeat, or you're having these episodes, I would be concerned that there is some chronic inflammation going on in the body. One of the other things, we didn't go into this with this presentation, but when you start seeing high blood pressure, I mean, what a lot of times what that's telling us is that endothelial lining is not producing nitric oxide properly anymore, which, I mean, normally it will expand when it feels like, okay, there's increased blood volume here, so it'll expand and your blood pressure will stay normalized. But when that stops happening, you're getting some stiffening in the arteries. Again, reversible, but it's just a sign that there's something abnormal now with that vascular lining. Of course, I can't say that that's necessarily the case here. There's a pretty extensive workup on heart rhythms, and sometimes it's diet, caffeine. There's genetic dispositions, medication, supplements. A lot of supplements will have contaminants that you wouldn't expect, and they can cause the heart rate to go up.
Okay, we have a couple of questions about diet. The first one is, what would be a good choice for breakfast?
I would say a substantial meal. I wouldn't try and skip breakfast. They actually, I've read studies where and this isn't what they used in the study, but eat breakfast like a king, lunch like a queen, and dinner like a peasant. So you would want to have a good substantial breakfast that included protein. You could always, I will always encourage vegetables. So if you throw that in with your protein, that's great. But fruit, some fruits, you can get some of your antioxidants in there. But a substantial breakfast that included protein, or some well-sourced fat or protein, like an egg or yogurt. If you were vegetarian or vegan, then I would try and get those proteins through nuts, or the nut yogurts like almond yogurt, or so I would try and get it through vegetable source protein, but something with protein and or fat, and then add in either the vegetables or fruits. And I would avoid any high sugars juices, or adding a lot of sugar or sweeteners to your coffee if you can, would be my best advice.
And I would throw in some green tea. I think, they're throwing some. A couple of things, and it's not exactly your question, but I would just like to add that not snacking. So you don't, like Rachel was talking about, that insulin, like you need your body to have a break from having to continuously produce insulin and have it constantly running in your bloodstream. And because it's insulin itself is so pro-inflammatory, and then you're just in this vicious cycle, and insulin will promote that waste fat to accumulate. So you don't want the snacking, which means now, like ideally 2 meals, not 3, but so you want your 2 meals to be actually substantial and appropriate. You're not trying to it's not really about calorie counting. It's about really eating well, actually, but just eating the right foods, and then giving breaks. And this has changed, like, I think 10 years ago or less than that, they were saying snack frequently and have smaller meals, but that's really actually not good for the body.
That probably goes into the question about intermittent fasting and good for cardiovascular health. I would say yes, it gives that body a break. I mean, obviously it's not for everyone, but at least giving at least a 12 to 14 hour break from, eating dinner to breakfast. It is good for your cardiovascular health, because it gives your body that break of trying to respond to something that you're putting in your body. So yes, I would say, but it is obviously, it's not for everyone. There's definitely some people that should avoid intermittent fasting, but it is good for cardiovascular health.
Yeah.
Okay.
And oatmeal, I would say, is a good carb. I would say it is a good carb. It's a good fiber. So.
Yeah, it's debated a lot. I'll say a couple more things about oatmeal. It's a fiber, and one of the big concerns with going like extreme keto, like to do extreme keto, is that you're not getting your probiotics in anymore. So, and you need that fiber. I'm sorry, the prebiotics. So you need that fiber and the prebiotics. And some carbs are still beneficial. I would say limit the oatmeal. But the other big thing about the oatmeal is that you want to soak it overnight. It has to do with the phytic acid and so otherwise you can have issues with absorption of your nutrients.
Okay. The next question is asking, could you please explain atrial fibrillation and how serious it is?
Yeah, okay. Yeah, and atrial fibrillation is basically so we talked about those 4 chambers in the heart, and so the 2 smaller chambers, it's when you get your atrium, one of those small, it's actually it's supposed to pump and initiate that heartbeat, and instead of initiating properly, it just starts doing a little quiver, and so what happens then is sometimes it'll beat really fast and it'll continue to pass through. So sorry, not quiver, because that would be a different arrhythmia that's more concerning. But basically, what happens is that get an atypical, the beat is not starting from the appropriate spot in that atrium. And so the beat is actually much more rapid than it should be. And what happens is that sometimes it's so fast that you can't actually get that proper pumping of the ventricles, and then it's not actually going to the aorta like it's supposed to. So there are different treatments for it, but sometimes the treatment is actually just bringing the rate down, so the person will still be in an atrial fibrillation, but because their rate is slowed, the ventricle is still able to pump, and then it can still supply the body. But if it's very fast, it becomes very dangerous. So in general, yeah, I would consider atrial fibrillation to be dangerous unless it's controlled. There are other risk factors associated with it, like if someone is in chronic AFib, there's risk of clots. Of course, you would want to do some work on to see if it's something that can be reversed. But there are different causes for it, so sometimes it has to do with prior heart attacks. Sometimes they find where the beat is starting from, and then actually can do a procedure and address that, so that you can actually go back into normal rhythm.
Okay. The next question is, if you're watching your thyroid function, what are a few top tips for keeping your thyroid function in good shape?
So I would say maintaining good gut health. We have such a thyroid gut connection that we would want to make sure you have good gut health. We would also want to make sure, do you have your gallbladder? Because if if not always are you breaking down those fat soluble vitamins if your gallbladder is gone. So potentially needing some digestive enzymes to making sure we're getting those fat soluble vitamins that are really important for our thyroid. Selenium, and selenium is a really important antioxidant. Zinc is a really important antioxidant for your thyroid. So those are a couple things that we would want you to include to make sure you have good thyroid health. Anything else I'm forgetting, Selma? I think that would.
Yeah, I think also it's so many people have Hashimoto's, which is the autoimmune hypothyroidism. So and then Rachel had this on her slide, and we just had to cut a lot because it was just too long. But just getting that full panel where you're checking the antibodies as well.
Right.
Yeah, and the reverse T3, and I mean basically it's you do want to see the whole picture. If the antibodies are positive, then again, like Rachel was saying, looking at the gut and seeing if you can determine why those antibodies are positive and reversing that. Yeah.
Okay. We have gone over our hour time limit for the presentation, so I'm just going to address one last question to you two. Can you explain again how to identify when you or a loved one is having a heart attack?
So often women, not always, but often women can present different than men. The classic symptoms are chest pain, left-sided chest pain, feeling nauseous, sometimes vomiting, feeling very sweaty, sometimes a little lightheaded. So that's the classic. And then women often present differently and can be indigestion, just nausea, or even just GI upset, or just feeling off. And in class, another classic symptom is that pressure on that mid-sternal chest. So that's another classic symptom. So those are good ways to identify some of the classic and atypical symptoms.
Okay. Thank you both so much. This has been really informative. I think you answered a lot of questions. For those of you who had a few other questions that we didn't get to, there were a few other questions about, refined sugar and whether or not cheese is okay, and more about Hashimoto's. I would encourage you to get in touch with these two presenters. They're very knowledgeable. I've put their email into the chat, so you can ask additional questions, or you can get in touch with your primary care provider and ask them directly. Unfortunately, we don't have additional time to keep answering questions. I'm sure that we could go on forever. This is very important information, but thank you both so much for presenting and for answering all the questions that people had tonight. And again, I will email out the slides that they used tonight, and I will also email out a link to the recording from this evening.
Thank you so much for having us, and thank you everybody for joining.
Yeah, thank you so much.
Thank you. Good night, everyone.
Good night.
Thank you. Bye.